Discogenic low back pain, or DLBP, is a major cause of chronic back discomfort worldwide. This condition is primarily linked to degeneration of the intervertebral discs, often accompanied by inflammation. People suffering from DLBP experience not only persistent pain but also a reduced quality of life and limited physical function. Additional treatments like physiotherapy, exercise, and oral medications are commonly used, but their effectiveness is often limited, especially for those with severe or persistent symptoms. In recent years, new minimally invasive procedures targeting the discs themselves, known as intradiscal procedures, have been developed. These aim to directly address the source of pain by modulating inflammation or nerve signals within the disc. As we explore these innovative treatments, it's important to understand both their potential benefits and the concerns that come with them. Several intradiscal procedures are now available for managing discogenic low back pain. These include steroid injections, methylene blue injections, platelet-rich plasma (PRP) injections, intradiscal electrothermal therapy (IDET), and radiofrequency techniques, both continuous CRF and pulsed PRF. Each method works differently. Steroid injections aim to reduce inflammation but typically offer only short-term relief. Methylene blue targets nerve endings but has shown inconsistent results in studies. PRP injections use growth factors to promote tissue healing and have shown promise, though more research is needed. IDET uses heat to modify disc structure and nerve pathways, but its effectiveness and safety remain debated. Radiofrequency treatments, especially PRF, are gaining interest for their ability to modulate pain signals without causing significant tissue damage. However, the evidence supporting these procedures varies and long-term benefits are still uncertain. While intradiscal procedures offer hope for those with persistent discogenic low back pain, they are not without risks. One major concern is the potential for these interventions to accelerate disc degeneration, especially when needles or heat are used repeatedly or with larger instruments. Studies on similar procedures like discography suggest that using fine needles and limiting the number of procedures can reduce the risk of long-term disc injury. However, repeated interventions, even with thin needles, may still contribute to disc damage over time. Some techniques such as IDET and CRF carry additional risks like thermal injury or nerve complications. Because of these uncertainties, experts recommend careful patient selection and limiting the number of procedures. Ultimately, more high-quality long-term studies are needed to clarify the true benefits and risks of these treatments. For now, intradiscal procedures may be considered for severe cases, but caution and individualized decision-making remain essential. Summary: intradiscal procedures represent a promising, but still evolving approach to managing discogenic low back pain. While some methods like PRP and PRF have shown encouraging results in relieving pain, the overall evidence remains limited by small study sizes and short follow-up periods. Risks such as accelerated disc degeneration and procedural complications must be weighed against potential benefits, especially for patients with severe treatment-resistant pain. Best practice is to use these interventions sparingly, with thin needles, and only after conservative treatments have failed. Looking ahead, the field needs more rigorous long-term research to establish clear guidelines and improve patient outcomes. As our understanding grows, these procedures may become safer and more effective options for those struggling with chronic discogenic pain.